Welcome back to Module 2, the accessibility of services, part of the 3 components of our client's experience of care. The accessibility of services describes the foundational elements of the Family Van's model of care delivery, how we make services particularly accessible to our clients. In many cases, we reduce or eliminate what would otherwise be barriers that are experienced in other healthcare settings or have features that other healthcare settings may lack. These logistical details have a significant impact on how our clients experience their care. This diagram shows that the accessibility of services includes 10 factors that were identified by clients. Counterclockwise from the top, these factors are the location and timing of the schedule, that there is no payment or insurance required for services, no appointments required, lack of wait time and reduced paperwork, sufficient time with healthcare providers, multiple services, preventative services, community-oriented services, resources for foreign language speakers, and cleanliness. Let's look first at the location and timing of the schedule. Clients told us that the Family Van's weekly locations and the timing of their visits were especially convenient for them. They described this convenience in many ways, whether the location they visited was near to their residence, near to their daily activities, close to public transportation, in their neighborhood, or where community members are at higher risk. When he was asked about the accessibility of the Family Van, one client responded,
"It's key, it's accessible to the community. You can say, hey, we're right down the street, and people will walk right over. It's just a hop, skip, and jump away."
Another client compared how the location of the van was near to her daily activities as opposed to her doctor's office. She said,
"There are some days I feel like crap and I'm like, damn, I should go to my doctor. But a lot of times I don't have the energy or I don't have a ride. So if I don't have the energy to get to the Brigham and sit there all day just to come all the way back home, I'm going to go where it's closest to me. See, I'm always in Dudley. So normally if you see me on the van, I'm already in Dudley for something."
Another client commented on the timing of the weekly schedule by saying,
"I don't know the exact schedule, but I know they're there when I need them. It's very convenient. It's there when I need it."
Another factor of the Family Van's accessibility is that there are no payments or insurance required to receive services. When asked what she thought of the free cost of services, one client commented,
"I think it's really nice because, like I said, a lot of people around here don't have money. A lot of people around here are struggling. So with it being free, it is accessible for everybody who wants it."
While many of our clients are insured, for those who are not, this removes a barrier to care. For one first-time visitor to the Family Van, he noted it was the only place he could receive care without insurance. He told us,
"For the last 3 nights I've been saying, I got to go to the hospital. I got to go to the hospital. So I went today and I didn't have any insurance. So they couldn't see me. I was supposed to be seen 3 days ago. But since I don't have insurance, I had to cancel it. But today, being able to go to the Family Van, it's a gift."
Walk-in services were also identified as another benefit that reduces barriers. Many compared their visits to the Family Van with the challenge in making appointments with other healthcare providers. One client described,
"If you want to go to a hospital, but you have to make an appointment. At the Family Van, you don't have to wait 6 months for your appointment. You can just go right in there and really get a head start so you know what's going on. So that's what I think is the best thing about it."
I get services, advice, and information from the van a lot more than I do with my primary care doctor. That's another reason why I come on the van a lot, because I have to wait 3 or 4 months before I see my primary care doctor. So within that period of time, I want to make sure that I'm doing all right along the way before I see him. So with the van being here, they're more available than my primary care doctor in that way.
Another factor that clients frequently noted was the lack of wait time compared to their doctor's offices, as well as the reduced amount of paperwork required before seeing a provider. Most clients experience a wait before seeing their physician, but most family van clients do not experience long wait times. As one client told us,
"You're in and you're taken care of right away. It's not like you sit there and wait, and wait."
Another client noted that test results were received quickly.
"I like to know right away. I just feel better."
When asked if there was anything that the family van does that he would like to see his doctor do, one client responded,
Mainly the accessibility, the going in without having to fill out any forms and waiting half an hour just for a simple blood pressure test. It's more personal on the family van than it is in the clinic. At the clinic, I go in and I gotta wait, I gotta fill out forms and stuff for the simple things like a blood pressure screening.
Clients also felt they had sufficient time with the service providers on the family van. One said,
"They don't just provide the service according to time. They provide service according to the patient's need. Whatever I have to say, they listen to every problem."
In contrast, in other healthcare settings,
Everybody's pressed for time. That's the biggest problem. You can't use their time.
clients acknowledge that having multiple services on the van was convenient for them. One client said,
I think the flexibility of just opening the door and getting 4 or 5 different outreach workers and checkups done with the family van is unique, is very unique.
Furthermore, another client noted that
sometimes you cannot go to the hospital to check your high blood pressure because nobody else has that type of service unless you go through the emergency room.
in addition to the medical services, the family van also addresses the social determinants of health that go beyond medical interventions, like referrals for food stamps and memberships to local gyms. Where we live, work, learn, and play has a major impact on our health, so these interventions often create major improvements in health. One client described that the family van service providers
don't just look at your health, they look at your housing, at your employment, and your family situation.
The services on the family van were also described as preventative. One client stated,
To me, Western healthcare doesn't prevent stuff. It just treats it after it becomes a problem. The van helps you work on preventing things. It helps encourage you to take the steps to help prevent things from going bad.
Another client described this phenomenon as the way clients feel when they step on the van.
The family van is like, I'm going to get something checked. I'm in a doctor's office. I'm sick. It's a mentality.
Furthermore, the services on the family van were described as community-oriented. In comparing the family van to other healthcare institutions, one client explained,
Well, they're a different operation, different mission. The family van is a small operation that is tailor-made to the community.
in fact, this is a major part of how the family van operates. All our locations and services are picked in concert with our clients and designed with their input. They tell us where to go, at what times, and identify new health concerns that they would like us to address. Resources for foreign language speakers were especially valuable for our clients, whose first language was not English. One native Spanish speaker commented that,
They offered me help, especially like my language. They told me, what language do you speak? Do you need some help with the language? Do you need an interpreter? So They looked for a way to help me out. They really made me feel better. They made me feel welcome when I got into the van.
Finally, cleanliness was a feature on the family van that many clients mentioned as important to them. Interestingly, the small size of the family van was not an issue. As one client described,
At the doctor's office, you go there, they pull the curtain or they shut the door. You wait for your doctor, and you're looking around at the four walls, waiting, It's like, okay, anytime now. Here on the family van, you don't have that feeling. You don't feel confined. As small as the van, it is less confining than a big hospital.
these factors describe several facets of this model of care that are especially successful in the eyes of our clients. While these features may not be exclusive to mobile health clinics, the family van's model using many of these factors is what differentiates it and other mobile health clinics from traditional healthcare delivery. As we will discuss in the conclusion, these features are what also make the family van so effective at reaching the underserved and improving the health of them and their communities.